Okay, this is an unofficial conversation that I guess you and I have been having, we've been having at the house and for a long time around peptides. And I think everyone's probably heard that word nowadays. And so I don't know, maybe we'll start there. Maybe I'll ask you what's in your mind or in your education, what is a peptide? How do they work? What's all classified in that? Because I think that conversation, obviously FDA is really involved in that now, getting those approved.
Yeah, so certainly I feel like we talk about it a lot, but I also think it's kind of the buzzword in the health and wellness community. So maybe not the buzzword for everybody. It's probably not a typical dinner table conversation, but it is around our house. So, um, yeah, I think peptides, my basic understanding of peptides, I guess in the simplest version, is that they are a chain of amino acids that make up a protein. A protein, when you throw that word out to the general public, people think chicken and eggs and tofu, but really our body is comprised of proteins that function as messengers to tell our bodies to perform a function. And so a peptide is just a component of that messenger system, is, I guess, my version of explanation in probably some of the simplest terms. Yeah. So,
Yeah, I think that's a great explanation because it's kind of confusing how they work. And then I think the big breakthrough, and maybe we could talk about that next, in peptides, like they've been around for decades, right? This idea that you can take an amino chain in your body and synthesize it outside and then put it back into your body, essentially just like hormones, to make you feel better is not new, but really what's made it change over the last 5, 6, 7 years is the rise of GLP-1s, which
right.
are just a peptide, right? They're just an
Yep.
amino chain. But those is kind of what's opened this conversation across all peptides now.
Yeah, certainly think that's the common thread that people are talking about right now. But even if you want to take it further back, technically insulin is a peptide. And so if we talk about like synthesizing peptides, and I guess I should define that word as well. Synthesizing is basically creating it in a lab of some sort. So you're making something. Yes, your body naturally produces it, but it is now, with modern technology and modern science, there's the ability to synthesize it. And I guess I say insulin is probably the earliest one I know of. Maybe there's something even before that, but um, so yeah, but certainly in the last however many years, GLP-1s has definitely been the peptide that people have been talking about. And there's just been a lot of breakthrough with creating that, and then the use of that and the prescription of that, why we're using it, has broadened over the last, I don't know, 3 to 5 years. And certainly I think will probably continue even in the future.
Yeah, that's right. Yeah, insulin's a good one. I forgot that was it. And so if people were to ask, and people have asked me and probably you, um, is this natural? And right? And so I think that's an interesting way to say, well, I'll give you my explanation. You could probably give it better, but it's not technically natural, much like adding synthetic testosterone to your body is not technically natural. But it is, right? Because it's just a synthesized version of what your body already produces. And so it really is working with your body versus against it. And I think that's where like big pharma, we're pretty anti, even though we're pro in some categories also, I guess. But yeah, I think they
Okay.
what?
That's a conversation for another day.
Yeah,
There's a whole lot to that topic, but we'll
yeah.
get there someday.
Yeah. But I think being more holistic in nature and in our thought process, it does work with your body because your body's already creating these amino chains to do certain things like regulate hunger. And so that's why GLP-1s are incredible. And GLP-1s to define, actually, I'll have you define it. What is a GLP-1?
You're gonna get me
What's the modern
fired
term?
up. Well, first of all, I want to say there's this term that comes to my mind when you talk about are they natural? There's this term in the functional medicine world called molecular mimicry, which basically is creating a molecule that mimics something your body makes. So it's an identical, so when you put it into your body recognizes it because it's molecularly the same. And so, yes, created in a lab, but recognized by the body as the same thing. So, yeah, it's not a chemically derived compound that is working against your body. It is utilizing the natural functions of your body to just optimize what your body naturally does. Okay. Um, Back to the question you just asked me. Oh,
Yeah.
GLP-1.
Yeah, GLP-1, we're going to say that word a lot, which is technically is a peptide, but it's good to break it out because it's the skinny shot peptide that's popular, but technically it's under the peptide category. It's not a separate thing from that. It's just the popular version of that.
Yeah. So GLP-1, I probably need to do a little further research and all of that. But no, so the general idea of GLP-1 is a signaling to your body, and it does a couple of different things. So a GLP-1 is something that your body naturally produces. So just like we've been talking about, we're not putting something in your body that your body doesn't already or hasn't already been made. But we may be giving more of a certain signal to your body. And there's a couple of things that the GLP-1 does. It creates a sense of satiety, meaning you may eat a certain amount, whereas in the past you could eat triple that and feel full, but you eat a singular helping of something and you feel a sense of satiety, which is like fullness. So that's one thing it does. And then the other thing it does to allow for this sense of satiety is that it slows gastric emptying, which also is my little science brain going here, but basically just slows things down, meaning it moves through your body at a slower rate. And so because of that, you're really not as hungry as you are whenever your body and your gut inside is moving at a faster pace. So those are two ways that it works. I don't know. You may know more, or you may have another thought
Well,
right now.
yeah, actually, as you're talking, and this we can do research on the fly. Obviously, so in Claude, I just typed it in, but yeah, it tells your pancreas to release insulin when blood sugar rises. But GLP-1 stands for glucagon-like peptide. So it really focuses on your gut response to eating, and it signals to the brain that you're full, and it quiets food noise. And so those are kind of the some of the ways it works and maybe the symptoms of it, which are positive. And that's why it's incredible. Is I mean, people have lost lots of weight. So the first one's just there's Ozempic, there's Wegovy, there's I mean you can go down the list of the name brand Zepbound, that are the popular ones, and they were just GLP-1s. Now they're actually coming out with a compound with two GLP receptors in there, like tirzepatide, and that one is Manjaro and Zepbound. Those kind of have two dual agonists working with them. So, anyways, in plain English, your body kind of already makes this hormone. It just tells you when to stop eating. And honestly, I mean, if I'll be honest, and maybe you too. When it first came out, I was like, if people do that, it's cheating. You just, you're not lacking the willpower. You're not, you should probably just do something different that's hard, and this is the cheating or the shortcut. And I've completely changed my mind on that, for maybe a couple reasons, but I think the main one is it just totally works, and it works with your body, and there's incredible results. And we just live in a society now that we are just constantly have these foods that don't make us feel full and have this food noise. And so you can do everything right, and you should layer all that in. But anyways, I kind of want to maybe you could speak to how do people not feel shame or guilt even around discussing or thinking about these things?
Yeah, I actually think that's probably I think that's a very common thought process that a lot of people have. So I think we should maybe spend some time here because I think in the beginning part of even what is this and is there any chance this could be for me? I think you have to get over this hurdle of what I've always thought, or is there a stigma? Is there a taking the easy way out kind of route? And if so, then I'm not going to do it. And I think you and I both are not wired to take the easy route. I think, I don't know. I think there's something in us that's kind of ingrained with saying if it's the easy route, it can't be the right way or it can't be the best way. And so, if that's the case, then let's throw that out. And that's for other people. We'll do it the hard way. And I think a couple of different things have just transitioned over the last, I don't know, year for us where and I guess I can speak for myself. You can jump in here at any time, but there's a couple of different things of saying sometimes the hard way is not always the right way, and sometimes the easy way is not always the wrong way. And I think you have to measure that. I think I'm just going to philosophically say, what do we have to prove in this life also? And if this is part of the framework of thinking, then maybe we need to pull back the layers of that as well and get to the bottom of that. I know we're talking about GLP-1s, but maybe there's a deeper conversation um, to why and you just voiced that yourself too, have been anti or even in a way judgmental of somebody who was unwilling to diet or unwilling to exercise or unwilling to just do the hard work and let's just take the skinny shot instead. um it's just not that simple, and I think there is a lot of things to it. You mentioned the word food noise, and I think one thing that kind of puts me on a soapbox is that the processed foods that are the majority of foods in America are chemically derived to make you hungrier. And so it's interesting whenever you're just eating a standard American diet, it is a it is designed to work against your system, to work against this GLP-1 that naturally tells your body, I am full. It is time to be done eating. There are chemicals in your body that talk to both your gut and your brain that keep that noise, that like satiety noise, very, very low. And the food noise of what am I going to eat next? How much can I do? This like ongoing dialogue in your head going and going and going. And so, um, I'm not necessarily trying to play the victim card here, but I think in a way, we are kind of like swimming upstream here, that maybe like our grandparents didn't necessarily live in the same type of food environment that we do today.
Yeah. Yeah, and we live in a time and place where there is something that can help you. You should take it because I think that's what we've learned. Everyone deserves to feel their best, and instead of holding this martyrdom of I should do it the hard way, and that's not even really true. There really is. I mean, the hard way may not work for you. I think everyone deserves to be, yeah, the 20 or 30 or 40 or 50 pounds less, because that's whenever you can live life to the full. That's when you can live your best self and you'll show up different mentally and have more confidence and you'll live longer. I mean, literally all the comorbidities are mostly caused by just being a little bit overweight. And so if that solves this and you get to live an extra 20 years by getting those pounds off now, then why is there any shame in that? That's insane. Right? Literally insane to think. The point of this is not for vanity always. It really is so you feel better and live longer. And there is no better cause than that.
Yeah. I mean, how many times have I said in the last year of my life, we only get to live once. So what are we waiting on? We want to live. This is the best. This is what we've got. So what are we going to
You
do
only
with
get to be this young one, so while you're this young, go ahead and feel your best. I'm going to read this quote. This has been my favorite quote that, as we've done all the research and podcast listening and even using peptides ourselves over the last year or so, that's been my favorite. And it reads this. It says, there's a population that traditional medicine serves poorly, and it is enormous. People who are not sick enough for aggressive intervention, but not well enough to feel normal. Not dying, but declining. Not diagnosable, but miserable. Doctors call this subclinical, below the threshold of formal disease, but above the threshold of suffering. Insurance does not cover it, as specialists are not sure what to do with it, and peptide culture speaks directly to it. because it promises precisely what the medical system cannot: a protocol for the gray zone between you're fine and something is clearly wrong. The emotional engine for peptides, it's not recklessness, it is actually abandonment by the medical system. That's what it's talking about there. So, any thoughts on that quote? Because I think we've talked about that quote before and how really that's why this is rising up to the popularity it is people are sick and tired of being in that gray zone, of going to the doctor and big pharma not having a medicine for them, and people thinking, I still don't feel great, or I know I could be healthier.
Yeah. I mean, I just think that quote probably spoke to everybody in some capacity. I don't maybe we feel great in certain areas, but in some way I feel like I mean, I can raise my hand and say I fall in that certain category too. Is like, is this normal? And I think that's where we also quiet ourselves to say, is this normal? Is this how everybody at my age, my stage of the game, my whatever, my weight, my whatever category you're going to put yourself in, I think you wonder, is this normal? I have headaches every day. Is that normal? I'm tired all the time. Is that normal? I am a little overweight. Is that normal? You know, those things that, and then you go to the doctor and say that to them. And I guess I can speak to this because I've been in the medical world a long time. I to the casual listener, I am a nurse. I became a nurse. I've been a nurse for over 20 years. I went back to school. I've been a nurse practitioner for like 12 years. So I've done a lot of the like formal education in the medical world. Stopped at nurse practitioner there. Then I went back to school to get my functional medicine certificate. So, anyways, I'm kind of a school type of person there. But what I'm saying to that is they don't talk about this. This is not something that I learned in any kind of formal medical training, and I've done years and years of it. And so, what formal medical training does is you have a patient with a symptom, you give the symptom a diagnosis, and then you treat with a pharmaceutical. And so it's this very systematic form of treating patients. And that's what we've learned. That's what we've been indoctrinated with. That is really what Western medicine says is the right way to do it. Even and I mean, this would be another soapbox I could jump on, but even diet, exercise, lifestyle, sleep, stress management, those types of things are not discussed in nurse practitioner school. That's not discussed in Western medicine because those are modifiable things that could potentially optimize your health, but they're not anything that big pharma can jump on. And so, anyways, the quote that you read, and I'll be quiet and let you talk here in just a second, but the quote that you read resonates so resoundingly with me, but also with so many people that I talk to and hear with clients that I've worked with, is just saying, the doctors say I'm fine. My blood work comes back fine. I don't feel fine. Am I fine? It's like this big question of like, really, I just need to get over this? Or is there something out there that could be different? And I think that just is this gray area where lots of people have the same question.
Yeah. Yeah, totally agree. And that's where I think, is this the easy shortcut method or path that we're talking about earlier? The answer is no, because the goal of these is to create the momentum that you then do layer in a better diet and better sleep and more hydration and then exercise, right? But oftentimes these things can really help you get that momentum, get the progress started. And then with no food noise, you show up differently and you want to eat healthier. So it all does tie together to getting you to actually do it the hard way or the right way or the way you want to do it. And so that's what I think is really cool about this. These are just kind of momentum builders in the right direction, working with your body. And to your point, there are some side effects to these things, but not very many and not very much because big pharma puts in kind of all these other chemicals to work with your body, and then there's always side effects to those because those chemicals you're putting in your body are not normal complexes to your body systems. So it's kind of counterbalancing the symptoms, exactly what you said. So this is medicine truly 3.0. Medicine 3.0, I think peptides fits in perfectly around longevity and health and diet and all that. Medicine 2.0 and 1.0 were great, but now we've moved on to I saw something the other day. This is not your this is not your grandmother's medicine, right? This is the next wave that I think most people are after. And so I think, yeah, go ahead.
A little bit further, I know what medicine 3.0 means, but I don't think the average person kind of knows exactly what that terminology is that you said. But I think that's really important in this talk. So define that a little bit more.
Yeah, so I think medicine 3.0 is really going after the longevity and you feeling healthy and being healthy now before the comorbidities, which is a definition needed, right? Which is cancer, which is heart disease, which is diabetes. Like there's, those things, Alzheimer's. I mean, down the road, you get these things because of poor health over the years. And so medicine 3.0 is actually preventing them from happening 20, 30, 40 years from now by being healthy now. So it's a longevity protocol of getting your body weight in check, dieting, exercising, yes, all these things. But really, it's attacking living, feeling really great now, but also the long-term benefits of that should lower the chances, or does lower the chances of getting all those things that are the number one killer of people over the years. And so it's really a longevity game and a prevention game, and you start it today versus medicine 2.0 reacts to, oh my goodness, your heart's blocked, and so we're going to put you on a pill.
Mm.
Medicine 3.0 would say, well, if you would have died and exercised and had some weight off 20, 30 years prior, the likelihood of having that heart disease is probably non-existent. Now, of course, it's never zero, but it's a lot less. So that's medicine 3.0 versus it's not reactionary. It is thinking into the future more than it is right now.
Okay. I heard the two terms, the difference between lifespan and health span. I think it kind of falls into that conversation piece there is lifespan is literally the number of days you're alive. Health span is the number of days that you're healthy enough to enjoy your life. And so if you think about that in terms of just prevention and aging and prevention of comorbidities, like you talked about, I think there's a lot to that puzzle piece there.
Yeah. And I think kind of next steps would be to go over some peptides. So we talked through GLP-1s, which are skinny shots and things to help you lose weight, essentially. Now, there's other actually benefits to GLP-1s outside of just that, but that's mostly what those are for. But now the world's kind of waking up to, and the FDA is kind of coming around to potentially releasing 12 more peptides that can be legally compounded at pharmacies and sent to you, and you can take it at your home. And actually, you can even do that now. Like we talked to a pharmacy in Fort Worth, and if you have a prescription for some of these peptides, they will fill it. They'll compound it, and they will ship it to you. And then most of these peptides, you can start taking tomorrow with the doctor's prescription. Now, maybe most peptides, it's probably worth knowing, they are injectables, not all of them. And so we'll start with BPC 157, and it is oral or injectable. Like I think we have the pills at our house and we have the injectable shots at our house. So there's both there. And so BPC 157, I'll kind of take that one. It is probably the most popular peptide you'll hear outside of GLP-1s, outside of skinny shots, because of it's been incredible. As we kind of read some of these articles and people taking it, it was originally designed to heal your gut, which honestly, since I've been taking it, I've noticed a huge change in my gut health, which has been incredible. And then I also had a shoulder injury from a ski accident a year ago, and it would click and pop and do weird things. And it was like a byproduct of taking it, but it is completely gone and healed now. And so what it does, right, is mechanically it sends aminos, right, healing aminos, essentially, amino chains. And if I say anything wrong here, you're the doctor, let me know. But to inflammation, it's looking for inflammation. So if your gut's inflamed or if your shoulder's inflamed, it adds these peptides to go and heal it. Because your body naturally is trying to heal it, but it kind of gives it a boost to actually get it healed. So it repairs tendons, ligaments, joints, reduces inflammation systemically. So again, like you're saying, if you have chronic headaches, this could be the reason. Maybe just chronic inflammation. If you have brain fog, it may be from just chronic inflammation. And so your body just not producing enough of these amino chains. Um, so, anyways, that's kind of the first one because that's going to be probably the most popular one as it becomes FDA approved is BPC 157.
I might just say one more quick thing about that one. That is probably one of the few, maybe the only one I'm thinking off on the top of my head that is an oral capsule and injectable, so it can be utilized in both ways. And the reason that that one is oftentimes put in a pill form is because of its gut healing purposes. So actually ingesting that and having that like actually located in the gut becomes really beneficial for gut healing. Most of the rest of these injectables are much more beneficial if they don't have to go through the gut, if they are actually injected into the body instead of have to go through the lining of the gut and have like that kind of decomposition happen. But BPC 157 actually is beneficial to be taken orally. Now, what you mentioned about like your shoulder, the injectable probably would have been just as good, if not better, had it been injectable versus oral. But if you're talking about gut healing, the oral, like taking it as a pill, actually is really beneficial. That one is one. Oftentimes, these are injected just into the subcutaneous fat, like in the belly or behind the arm. But the BPC 157 actually can be injected at the site of an injury. So, I don't think you actually did inject it in your shoulder, but you can, and there have been studies out there that have just because it just decreases inflammation in that area. And so even like post surgery, I've seen reports and studies of people injecting it around a surgical area or an Achilles that is bothering them, or certainly most injections are done in the subcutaneous fat tissue, but this one specifically kind of targeting that area and that site is beneficial for BPC 157.
Yep, that's true. And so I'm gonna look at I've got a list here, and if anyone wants to see it, I can send it to you. They're compounding pharmacy in Fort Worth, and I think there's you were just saying there may be one health center too. So different compound pharmacies can do peptides, but BPC's on there. 157 will be popular. And MOTS-C is another popular one that I've tried before. There's an AOD 9604, which is anti-obesity drug, which helps you burn visceral fat naturally. There's tesamorelin, and a lot of these will be over your head if you're just a casual listener, which is great. I think if people are interested, let us know. We can do a deep dive on each of these. But all of these technically, and there's a list of, I think, 25 or 30 here. 5-amino-1-MQ, GHK, copper injection, or GHK CU facial cream. That's really popular for people for skin health. So you can inject that or have that in a cream. NAD plus is on here, which is kind of a brain kind of cognitive function and energy. So there's a bunch more on here. I'm not even saying TBC 500 is a popular one. And then on here they also compound the semaglutides, which we were talking about earlier, which are semaglutide, which are the GLP-1s we were talking about, and then the trizepatides, which is kind of the 2-in-1. So you can get both of those from them as well with a doctor prescription. They also have, they have methylene blue capsules, and then they also have Super B complex. So I can send that list out to anyone interested, but there's a lot out there to kind of learn. I don't think today we'll go over all of them or their benefits, but there's just a lot of new options here, which I love. That's kind of anti-pharmaceutical that people can kind of now deploy if they're working with a doctor that could prescribe these.
Yeah. As you're talking right there, I have a couple more things I want to say about GLP-1s, or even just the science behind that medication, and even why we talked a little bit about how I feel like my thought has transitioned, your thought has transitioned, but I think one of the big things that I feel like it's transitioned is because it's not necessarily just, I want to lose 10 pounds, I need some help, let me take the shot. That we can go back and forth on whether that's beneficial or not, but There's so much more to GLP-1s and to even a reduction in visceral fat and just obesity in general, whenever we're talking about longevity, inflammation reduction. So the GLP-1 science behind that drug itself, yes, it is an appetite reduction. Yes, it does provide gut healing purposes. There's so many benefits to the gut and to decreasing food noise. But then there also falls in these categories of helping with brain health because it does decrease inflammation. And so, in the long run, if you're dealing with brain fog, I think there's even new studies showing that they're looking at it as far as like Alzheimer's treatment in the future. So, GLP-1 falls into that medicine 3.0 category and discussion, like you talked about, whenever we're talking about prevention of future ailments and future things that will actually kill somebody. These are things that are preventative in nature, even cardiac protection. And then when we talk about the insulin sensitivity, that's another really scientific deep dive that I am happy to do someday. But oftentimes we become less sensitive to insulin the older we get, especially in a standard American diet. And so increasing insulin sensitivity not only reduces the risk of diabetes in the future, but it provides a sensitivity to what insulin is actually doing in our body, which has so many benefits to it. So I just want to go back to just saying, yes, weight loss is really usually the whole like, I need to lose weight. How can this benefit me? But looking underneath the surface of what all that medication does, and recognizing that it's something that my body naturally produces, I'm much more okay with putting that into my body willingly than some chemically derived thing that my body doesn't really recognize and it works against versus with. There's a lot to that thought as well. Um, okay, one more thought and then I'll be quiet on this. We mentioned diet and exercise and lifestyle modifications. So in the long run, if you were to take a GLP-1 and not change anything, there would be some repercussions after you decide to come off of it. The weight would return if you haven't changed anything as far as diet or exercise. If you are continuing to maintain a diet, or if after you're off the GLP-1, you go right back to the way you were eating, that weight will return. And so I think that oftentimes is a lot of times people are afraid of that because they don't want to drop a lot of weight and then all of a sudden have a rebound effect and end up 50 pounds heavier than they were even before they begin it. So diet and exercise actually is a big component of that. Not only will you not want to eat as much, but creating new lifestyle habits really does become a really key player in that as well. And then even just reducing side effects. I know you mentioned there are some side effects that people talk about. There's some gut sensitivity to it. If you take too much of it, you can get really nauseous. If you eat too much, you can not feel very well. And if you think about that, that actually is the drug working. If we're overeating, our body is saying, hey, that's too much. I now have this signaling saying I'm done. That is your body naturally responding. So yes, it may not feel good, but it also is trying to train you kind of when to shut it off. And then another one of the side effects that I think a lot of people are worried about has to do with like muscle wasting. And so you're great at addressing that. Why don't you just talk about that a little bit? Because I think that is a side effect that comes up that is relevant, that needs to kind of be talked about with GLP-1s.
Yeah. Yes. I don't know when we do the disclaimer, but somewhere in there, every podcast we listen to says, this is not medical advice. This is for educational purposes only. You should consult a doctor. I am not a doctor. You are not a doctor. So, anyways, I think that's important to say. Like, yeah, please work with your doctor on this if you're interested, and not us. This is all for education because we want people to feel better. Yes, my thought on yes, I always say this. Who cares about muscle loss, right? I think it's a silly thing to even bring up when people need to lose 20, 30, 40 pounds plus visceral fat around their heart and liver. That's going to make them live a lot longer. Yes, you will lose some muscle mass in there because you're just not eating as much, but you can't have two goals. One goal right now is to get you healthy and get you at a healthy fat ratio, and then hopefully that builds momentum into building exercise and workout routines. Now, technically, if you want to work out during it, please do. Please add muscle along the way. That is better. But if that's not part of your current habit stack, then don't do it. I think you can have one main goal, and if it's to lose weight, you do not have to also lift weights. However, lifting weights and having muscle on your body leads to more longevity. So as you lose weight, you should want to do that as well. So that's kind of my 2 cents on it. And I think what's really cool about all this is it all works together. They all create synergies. And it's like this big cycle of let's say you start a peptide or you start a GLP-1. Well, then you lose some weight and you have momentum, but it also stops your cravings. So instead of a Coke, then you say, oh, I'm gonna drink some water. And so you drink a lot more water and you start tracking your water and you kind of get off the Coke addiction, if you will. So it really does break some addictions. And then you sleep better because you're not drinking Coke. And then, right, so it's like this cycle of health. And so when you do come off of them, hopefully you've created these new healthy habits that have been a lot easier because, along the way, you didn't have the food noise or the addiction noise or whatever. So it's kind of cool how it all works to a healthy lifestyle. But at the same time, I think working with somebody like you or a clinician or a coach or a doctor to make sure, number one, you're checking your blood work, but also help you with side effects, but also create healthy lifestyle and habits along the way. Like all that matters. And so I think that's my pitch to you can just go to row.co or whatever it's called, or HIMS or HERS, and you can chat with somebody and they'll send you semaglutide tomorrow. I don't think it's super advisable. I mean, it works, I guess, but at the same time, you just don't have a guide with you to check your blood work, to check your levels, to see how you're doing. And then as the weight's coming off, then you need somebody to say, hey, it's great. Or, we need to implement some other things in your lifestyle to make sure it stays off and to make sure you add muscle mass and make sure you don't feel bad. So I think there's a lot of nuance to this that just jumping on them with some online company could hurt you. And so anyways, I would always recommend working with somebody. True.
True.
Okay. I don't know if you're saying something.
Yeah.
Okay. So to close, I think that's a good kind of overview. If you're interested in learning more, I think you can encourage Erin to do maybe a daily deep dive on each of these. But just her knowledge, I think everyone's so interested in this, and just knowledge on each peptide individually. And then, like you said, on insulin, gosh, you could go so deep on that and why that's, insulin resistance, so it's called. Why that's so important just for your overall health and how that has everything to do with keeping weight off, actually, on, keeping your insulin levels low. And so then fasting ties into that, and intermittent fasting ties into that, and hydration ties into that. Like they all tie in together, but each of those kind of need their own individual kind of educational piece. But at the same time, I think you now as a clinician, you have a momentum starter for people that want to live a healthy lifestyle. And it may be a semaglutide, it may be a GLP-1, or maybe something else in that stack. Like those stacks, some are on cognitive, some are on libido, some are on just energy creation. Like the MOTS-C is just so your cells have more energy. And so there's so many things in there that people can now try that's outside of the supplement stack that really, I think, works usually much better than supplements do.
Yes, I agree.
All right, so last thing, let's say someone is driving right now and they just heard everything we said. They're in the gray zone. They've been told they're fine, but let's say they're still tired. Let's say they think something's off. And what would you say to them? And the other thing, I think, huge pillar we didn't get to on this one, but we will on the next one is it is GLP-1s, yes. It is peptides, yes. It is diet and exercise, and it's hormones, right? We didn't quite get to that one yet, but that would be a huge one that you would look at with them in their blood work is say, hey, we can jump on, peptides potentially, or maybe a doctor would say this, but I think too often the hormone thing is off as well, and so all that kind of works together in what this is and how this would work. So, I guess what would you say to somebody right now, or what would your advice be to them if somebody just says, I fall in that gray zone. I fall in the subclinical. I go to the doctor, they say I'm fine. My stomach still hurts all the time. I still have headaches all the time. I know something's not right, but I also know there's nothing they can do for me.
Yeah. Well, I think I'm just going to say what I feel like I've told a lot of clients I've worked with is you're really not crazy. You think you are, and you've probably been told that you are. And especially after you go to doctor after doctor after doctor and they say that you're fine and you still don't feel fine. It's hard to kind of get outside of that space in your mind. So um, you're not crazy. And if you don't feel fine, then there's something that needs to be investigated a little bit further. And I think if I could just encourage you to take the next step. There may be multiple steps out there, but take the next step for yourself. Be an advocate for yourself. I will say you're probably not going to get an advocate from whatever doctor is seeing you and telling you that you're fine. You probably need to either find someone else. But I encourage you to be an advocate for yourself. Go on podcast deep dives. There's so much information out there. I think we live in a world of where you can get access to information. And so you're the one that lives in your body. You're the one that knows how you feel. And I just encourage you to take the next step. You don't have to assume that they were right until, yeah. So just be an advocate for yourself.
Cool. So we just wanted to share our current curiosity stack, and peptides is obviously in there. Medicine 3.0 is obviously in there. And AI is in there, which is funny because I actually think that all works in this conversation where eventually artificial intelligence will help us figure out what peptides work best with our bodies and things like that. So, anyways, any questions, let us know, and we'll continue the discussion.
Good.